This segment is sponsored by the HealthWell Foundation. For 20 years, the HealthWell Foundation has helped over 900,000 patients and provided over $4 billion in medical financial assistance. And they want to help you too. And here to help share how you can get their help is HealthWell Foundation President and CEO Krista Zodet and Chief Development Officer Alan Klein. Welcome to Great Day Washington. Thank you for being here.
Thank you for having us.
Yeah, so you guys are celebrating your 20th anniversary. Congratulations on that.
Thank you.
Yeah, tell us more about the HealthWell Foundation.
So we're probably the biggest nonprofit that you've never heard of
That we've
before.
never heard of, okay.
Essentially, we help patients access life-saving or even, life-changing and altering medications that they otherwise might not have afforded. So we're really making a difference by closing that cost gap for them.
A huge difference, and a lot of people, 900,000. Mm-hmm. Wow, I mean, clearly you're very committed to helping patients. Tell us more about that. That number, that's a lot.
Sure. Yeah, I mean, if you build it, they will come. And there's definitely a lot of need, especially given that our healthcare system is essentially broken. And for so many patients, obtaining the medications and the treatment pathways that their doctors have prescribed is simply just not affordable.
Yeah.
And that's where HealthWell and some of the other foundations like HealthWell can step in and really make a difference for them.
Yeah.
Yeah, and in the richest country in the world, it's just a shame that the latest calculations that we've been able to obtain, over 30% of patients never fill their prescription because of costs. Or they try to manage their prescription by taking it every other day when they're supposed to be taking it every day because they can't afford it.
Right.
And they have to choose between their pharmaceuticals or paying their rent, or their pharmaceuticals and paying for food, and that's just not acceptable.
Not acceptable.
Not acceptable at all.
Yeah, wow. So a lot of people in need, but thankfully an organization like yours. How can people apply for a grant?
The best way is actually through our website. We do have a very streamlined online application process. The general criteria is patients have to have health insurance. So we do help the underinsured. They have to meet our income criteria, so there's a test for that, and they have to be seeking assistance in one of the funds that we support and currently have funding for. So that process is as streamlined as we can make it, and it can be patients or their advocates, their provider, their pharmacy can apply on their behalf. For those, again, who want to have a one-on-one conversation, we do have a wonderful contact center staff members located up in Frederick, Maryland, and they're happy to take those calls and talk with patients Monday through Friday, 9 to 5 Eastern.
Yeah, that's wonderful because it can be a little confusing.
Yes.
And you're talking about streamlining it, which is amazing, but because we all know it's quite a process. Outside of copay and premium assistance, what other help and benefits do you provide?
Sure, we do help with some ancillary costs. We have some vitamins and supplements funds. We do cover some lab costs and cost shares in some of our funds. And then we also have special initiative funds. Our pediatric assistance fund is one, and then we have some behavioral health services programs that help with counseling, psychotherapy, and transportation costs associated with that. Did you want to add to that?
Yeah, and we're always looking to figure out what else is stopping a patient from actually filling their prescription as prescribed by a physician. So we're trying to think both inside and outside the box as to what might be a gating issue for patients in order to be compliant with their treatment regimen.
Yeah, compliance is everything because they're just not going to be efficacious if you're not taking it as prescribed.
Exactly.
But then they have that choice when they feel like they can't afford it.
Exactly.
Alan, talking about the donations that you guys receive, some people want to know, how is that allocated? Are there specific buckets, or do you just use them as needed?
So we get donations from large donors who basically can pick and choose which of our 90+ different disease areas they want to support. So they make the choice as to where that money goes, and we will program it out as fast as humanly possible, and then it's my job to ask for more so we can help more patients, and it's a complete cycle of goodness when we're able to do that. Our individual donors can do the same thing as well, so they can pick and choose as well.
Okay, you have an important job, asking for more. Speaking of which, how can people make a donation? Where can they find more information on that?
So on our website, actually, we have all the tools that you need to donate online. And people find us all the time there. We've had in our existence over 70,000 individual donors find us through there. And I would encourage all your viewers to take a look there.
Excellent. Thank you both for being here. This is such great information, and you guys do such great work. Thank you.
Thank you.
Thank you for having us.
Again, there are several ways to reach out to the HealthWell Foundation for help. You can go to their website, healthwellfoundation.org. You can send them an email at support@healthwellfoundation.org, or give them a call at 800-675-8416.